Hi, Dr. Megan. Are you ready for your 15 questions with Vogue?
Yes, come on in.
Thank you. I really like your white coat. Can you tell me more about that?
Of course. My white coat signifies that I'm a licensed professional within the medical field. All doctors went through almost over a decade of training just to obtain the codes. A writer by the name Klein Struer published an article about how white coats are an easy identifier within the office and by patients. Let's have a seat. Let me type some notes while you ask some questions.
I see you're not wearing scrubs, but business attire with your white coat. Why is that?
The business attire also signifies my professionalism, and the white coat and business attire together is easily recognized by patients. It is even preferred by my older patients. A study reported on by Kara Gavin concluded that people over the age of 65 prefer a white coat and business attire. They just find it more professional.
I know you're in business attire, but I saw other people around the office wearing scrubs. The shape of scrubs is so unique. What's that about?
Scrubs have this unique and easily identifiable design, as I kind of stated before. In times of medical urgency, there needs to be a clear idea of who is able to help during the situation. I learned in med school from CareWare that's why often in hospital settings, workers of different areas wear different color scrubs to be a signifier on what they are knowledgeable on.
Yeah, I feel like I always see nurses and doctors in blue or green. Why is that?
It's actually funny you asked that because I also learned from the same source that when scrubs were first introduced, they were white to signify cleanliness and purity. In past decades, blue and green colored scrubs have fallen into favor. This is due to blue or green allowing a doctor's vision to refresh after looking at red all day, which is especially helpful for medical professionals who take part in surgery. But wearing blue or green, even for those who don't specialize in surgery, still has a use. Green, and especially blue, are proven to help and have a calming effect on patients. Although scrubs are mostly worn for sanitary reasons, it has just become the standard and an identifier of a medical professional. Studies show that blue and green colors are the best. Let's go explore more of the office space. This area is the common hallway, and it has a lot of our doctor's offices.
That's so interesting. What is a small thing that you do that is often overlooked that you use to indicate your professionalism?
It's actually funny you say that because a doctor that I know of that goes by TK Alexander did a study on how nails host a ton of bacteria. Therefore, I always keep my nails super short and clean because no patient wants to deal with a doctor's dirty nails.
That's so interesting. By the way, your hair looks amazing. How do you typically wear your hair when you're coming to the office? What are the acceptable hairstyles worn by medical professionals?
I always keep my hair in a slick back ponytail. In an article published by Our Everyday Life, they discuss how it's so important how your hair is shown because it represents who you are, what kind of professional you are. So since we are in a professional setting, I like to keep my hair looking very professional. Let's head on upstairs.
Cool, that's a really interesting badge. What is that?
This is my medical ID badge, and according to Specialized ID Incorporated, badges have many rules. One, they're a form of safety. Two, it lets my patients know that they are with a professional and they can share personal information. And lastly, my ID lets my staff know who I am and it IDs me very easily. Let's keep going into the medical exam rooms.
I feel like I at least see one stethoscope in a medical facility. Where is yours?
Oh my gosh, I forgot mine at home. I've been doing a ton of telehealth visits due to the pandemic. I usually have it on me though. According to Kluge Medical, stethoscopes date back to 200 years ago and are worn and used by medical professionals across the board. And they're an important tool for detecting anomalies, but also is an important symbol in the medical field. It's become so significant that even nurses now wear stethoscopes.
That's so interesting. I love your shoes. What brand are those?
Why, thank you. These are Asics. I wear them for support and comfort. Actually, according to Test Prep Nerds, their #1 recommended shoe for doctors and medical professionals are sneakers. Let's keep exploring the space. Excuse me while I fill out some of my patients' charts.
No problem. What do you usually do when you first meet a patient?
It's a really good question. I always introduce myself, and according to Medline Plus, this not only helps gain trust and show respect, but also helps me treat each person with compassion. I start with stating who I am, and my title signals to them that I'm educated, and it establishes a rapport with them.
A rapport, what's that?
A rapport is a relationship that I create with my patients. It is a positive thing to have. I make sure they feel safe and welcome when interacting. I do this because studies from BMC, medical education, found that it can mitigate patients' feeling of anxiety and vulnerability, and thereby improve their overall health and healthcare experience.
Gotcha. I'm sure it takes a special touch to make sure your patients feel comfortable. How do you use your voice to do that?
Diagnosing and treating illness is really important in medicine, but it isn't the whole job. In my opinion, more than half of medicine is being able to efficiently talk to your patient and ensure they have a good experience so they carry out their treatment plans. I make sure to use terms they are familiar with and fully understand, and I make sure to explain unknown terms so as not to confuse or frighten them. My friend Susan and her colleagues did a study that stated medical terminology can contribute to misunderstanding, and misunderstanding can lead to further illness. My job is to help you get better, and the best way I can do that is to communicate with you, the best of my ability.
That's all we have time for today. Thank you so much for doing 15 questions with Vogue.
Oh, no problem. Let me walk you guys out.
Thank you, Dr. McCully, again for having us in such a nice practice and giving us really a nice insight into what you do every day.
Of course, I always love to give people an insight on what I do on a day-to-day basis. Hey, if you're ever looking for medical treatment, feel free to contact me.
Thank you so much.
Of course.
Dr. McCully, I need you now. Step. Let's go.
I need to leave.